And welcome back. Well, the Battle of the Bulge has a new chapter, and this time, fat is losing.
How about that? I like that, right? That's a battle we'd all like to win. And Dr. Deborah Manjoney is here now with the Wisconsin Vein Center and MediSpa to tell us all about something called CoolSculpting. And trust me, after you hear about it, you're going to want to do it.
You're going to think it's pretty cool.
Is everybody in your office just so thrilled?
Everybody is doing it. Everybody is thrilled. Yes.
And you know, I think I've known you for a long time since we've been doing this show. I trust your opinion, and I feel like if you say something works and it's approved and it's got true results, I buy it.
This is a great one for bulges that you can pinch. Okay. There are other things that we have and more things coming because we're really going to be concentrating on body contouring, fat reduction. But this is fantastic. If you've got a bulge that you can pinch, it can be treated.
Okay, so this is called the CoolSculpting procedure.
Correct.
And I feel like there's a lot of gimmicks out there, so why do you feel that this one is different?
Well, this has been researched very well by people who I think are some of the most respected physician researchers from Harvard. And these doctors looked at some data. They had read some articles from the 60s that talked about children having fat loss in their cheeks by sucking on popsicles. And so they looked at that, and then there was another article that was published later that talked about women who were riding horses during winter months losing fat on the insides of their thighs. And so they then started to do a bunch of research about what happens when you cool and freeze fat cells. And we find that they actually go through a programmed death, a natural death. So you're not just losing fat, like mobilizing fat so it gets metabolized, you're losing fat cells, which is such a difficult thing to do because the number of fat cells we have are established very, very early in life.
Well, because a lot of times we talk about procedures that shrink fat cells, which probably can help.
Which is great.
Which is great, but this is the death of those fat cells. They actually go away.
Altogether.
Yeah, and I loved reading that. And what you just said is that research has shown that when fat cells are frozen, they begin a process of programmed death. So basically, over about 3 months or so, all of those cells will gradually disappear.
Absolutely.
So do you eliminate them through the digestive system?
You'll just like cells normally get turned over in your body, those cells will be eliminated.
Okay. I know you've got some examples through pictures too,
we have
because
some great pictures.
It's great to talk about it, but it's better to see it.
And you know, it really does make a difference. So you don't have to be really large to get an effect of this. It's just if it's pinchable fat. Okay. Because the applicator is actually a suction applicator that pulls the fat in. See, now this is somebody who's had a single treatment and then a second application. We are finding that a second application is fantastic because they will lose up to 40% of those fat cells
my
from
stomach
that area.
To look like that.
Yeah, exactly.
And we can actually sculpt because there are several different applicators, different shapes, so we can really help to start sculpting the body and shaping it.
That's incredible too. Why do you say that the best candidates are people who are about 10 to 25 pounds overweight?
Well, because they all usually, they work out, they're healthy, and they have bulges that are left, and they just have no way of treating them except something like this.
What about all the moms out there who have that belly fat that is not only belly fat, but it's kind of loose?
Yeah. If there's fat enough to pinch, it can be treated. And then we have other techniques can definitely tighten the skin. And so it definitely will work on anybody. As I said, if you have pinchable fat, and we can tell by looking at you and just kind of grabbing in different directions to see what's going to work, if this will work for an individual.
And men too.
It works for men. It works for people who are even a little bit more overweight. I mean, granted, if somebody's 40, 50 pounds overweight, you'd like them to lose weight first. Okay. But this can also be an adjunct to that because you can have them start to see their body really get sculpted in areas as they're starting to lose weight.
Results take a little while, so people need to be a little bit patient,
They need to be a little patient, but it's really not as long as you might think. We expect a final result at about 3 months, but people definitely start seeing results in 3 to 4 weeks.
Okay, you have this seminar coming up. It's called Cool Night Out. I love that. Cool Night Out, get it? CoolSculpting. With a free consultation to follow. That's happening Tuesday, September 24th.
Right.
There will be a midday session and then 2 evening sessions.
That's
and you ask for a $25 deposit. Explain the deposit.
Well, the deposit is just so we're sure we have limited availability of these spaces. And so by having the deposit, people, they put down the money, they'll come. And so it's just basically to reserve a spot. That $25 will be used toward a CoolSculpting treatment or any other treatment they want done in our facility as long as the person comes to the event. Okay. And so it's just really to reserve the spot because the last time we had one of these, we were overrun with demand.
I'm not surprised because everybody's got fat they can pinch. Raise your hand if you don't have some fat you can pinch.
I know.
And we all do.
Right? Yeah.
Somewhere
Right.
there's a little fat.
I
So,
wish. Okay, well, here's where the Wisconsin Vein Center and MediSpa is located. They're on Georgetown Drive in Pewaukee, 262-746-9088, so you can reserve your spot, wimedispa.com online. Thanks for being here, Doctor.
Well, thank you. I'm looking
Great
forward
to
to
see
the
you.
event.
Yeah.
Yeah, that's fun.
I'm
I
still
like that.
in shock. That was
I
that
know,
was
just
cool.
thinking about the death of fat. Is us.
What's better
R.I.P.
than that?
Exactly. Thank you.